Ontario schools are reopening for in-person learning on Wednesday, 2 days after originally planned. Education Minister Stephen Lecce continues to say schools are safe, but others argue they are anything but, adding that the province's latest safety measures are again not enough.
Nova Scotia's waiting before they have a return for at least a week. Ontario, we've got a couple of days. That's not going to be enough to get the N95 masks into all of the work sites. 3,000 more HEPA filters, still inadequate.
The president of the union, Ontario Secondary School Teachers Federation, says teachers are feeling anxious about the return to school.
Do you think 2 days is enough time to get all teachers an N95 mask and install these 3,000 HEPA filters?
The masking and the new measures we put in place overwhelmingly are not required to open school. The Chief Medical Officer of Health made it very clear these are going above and beyond the public health requirements, really just out of abundance of caution to build the confidence of our staff.
The government has abdicated responsibility and has said, okay, education workers, it's up to you. You take care of the herd immunity for us. We're feeling really scared.
Epidemiologist Dr. Colin Furness is calling on Toronto Public Health to defy the province and close schools until January 24th to avoid a sudden mass infection that could result in children being hospitalized. He made the plea in a letter to Toronto's Medical Officer of Health, Dr. Eileen Davila, which he made public today. Furness says that extra time will allow for the following, including emergency prioritization of 5+ students for first, second, and third shots as appropriate, emergency prioritization of teachers and other school staff for a third shot, and a formulation of a plan to enhance daycare air quality and PPE in lieu of vaccination. Critics also say a key safety tool is missing from the back-to-school plan.
We've got these big classroom sizes, tons of kids are not vaccinated. Why wasn't rapid testing included?
Well, we are, in fact, maintaining the take-home PCR testing kits for elementary and secondary students and for all staff who are symptomatic within our schools. Keep in mind, the province is really pivoting priority on rapid testing and testing in general on the most vulnerable in society.
If the situation continues to worsen, could we see schools close once again?
We will always stand ready to act, though, when we believe schools, or rather children and the staff within our schools may become unsafe. Our commitment is to keep them safe.
We asked Lecce if the N95 masks will be delivered to over 4,000 schools by Wednesday and if the 3,000 HEPA filters will be installed as well. We weren't given an exact answer. We were only told that they were on the way. For City News, I'm Maleeha Sheikh.